The forest was shrinking, but the trees kept voting for the axe, for the axe was clever and convinced the trees that because his handle was made of the wood, he was one of them. It is a Turkish proverb that they do not think that what the damage they are getting with the axe, but considering that it's one of the part, the major part is wood that is with them. So that was the Turkish proverb. Now, the complications of the typhoid fever, these are three types of the complications. Number one, general complication. Number two, medical complication. Number three, surgical complication. The first general complications are there are typhoid abscesses deep in the buttocks or the superficial like boils or the bed sores. There is tonsillitis, otitis media, and deafness. Zenker's degeneration of the muscles like rectus abdominis, psychosis, delirium, and the mental confusion. And there is severe dehydration, the complication. Then medical complications are acute bronchitis and frank lobar pneumonia, then toxic myocarditis, venous thrombosis, hemolytic anemia, acute typhoid nephritis, typhoid meningitis, peripheral neuritis, and the tender toes. And the surgical complications are intestinal perforation, intestinal hemorrhage, and intestinal obstruction. And surgical complication continuing, these are paralytic ileus, typhoid or acute cholecystitis, typhoid orchitis, mean involvement of the testes, typhoid osteomyelitis when it infects the bones, typhoid spine, acute pilitis, the urinary tract infection, cystitis, the bladder infection, retention of the urine, parotitis, and empyema are the surgical complication of typhoid. Now, the differential diagnosis of the typhoid, many conditions mimic typhoid fever, as I have already said to you that it is the king of actor on the stage of diseases. So, the differential diagnosis are malaria, bacillary dysentery, influenza, and acute viral diseases of the respiratory tract, brucellosis, tuberculosis, pulmonary and atypical abdominal tuberculosis, leptospirosis, trypanosomiasis, typhus and other rickettsial infections, septicemia of the gram-negative bacilli, acute bronchitis, lobar pneumonia, dengue fever, and acute abdomen with perforation, infectious mononucleosis, blood diseases, and in convalescence. These are all the differential diagnoses. Now, the diagnosis of the typhoid fever diagnostic tools are quite limited in their accuracy and specificity. Number one, history and the physical examination. Number two, culture, isolation of the causative agent. Number three, serology, detection of the antigen or the antibodies. Other laboratory tests, PCR, and therapeutic trial. So the first, history and the physical examination, history of the febrile illness without obvious cause, fever not responding to the symptomatic treatment for 3 days, and classical symptoms like step ladder fever pattern, abdominal discomfort, and the malaise is there, body ache, cough, bronchitis, or headache history, classical signs like relative bradycardia, which is a faggot sign, coated tongue, rose spots, and hepatosplenomegaly. These are all history and physical examining. Number two is the culture or the isolation of the causative or agents. First is the collection of the specimen. The specimens include blood or bone marrow, blood clot, stool, urine, and pus, duodenal drainage, or the rose spots. These are cultured, so the culture them using appropriate culture for the each specimen. In case of the blood or the blood clot culture, first it is cultured in blood culture broth, 2 bottles, to keep the bacilli viable and alive, and after 24 hours subculture the broth or SS agar. Number two is the stool culture. It is first cultured on salinite F broth to keep bacilli viable, then subculture on SS agar. So here one can see the blood culture bottle for the blood, and first we are going to just inoculate here, and then to keep the bacteria viable we just put this on Salmonella shigella agar, and to have this kind of black color colonies. In case of the stool, first on the selenite F broth and then on the Salmonella shigella agar, to have the colonies black, this type and this color. And the urine culture, it requires sterile bottle, inoculate first in selenite F broth with sediment of the urine, and next day subculture the urine on SS, which is a selective agar. In case of the pus culture, by a swab, culture onto the Salmonella shigella agar. And now there are certain chromogenic culture medium available which contains soluble colorless molecules called chromogens, which are being used by the different microorganisms to give colored colonies, and which are specific for each microorganism. These are time saving, and these are the latest improvement in this culture medium, which are the chromogenic culture medium. So here one can see the urine first on the salinite F broth, then on the Salmonella shigella agar to have the black colony, and in case of the pus you can put directly on the Salmonella shigella agar to have these kind of black colonies. And here are the chromogenic culture media, which are called hardichrome, and one can see the pink to the mauve colonies of the Salmonella species, so easily recognized, and here pink to purple colonies of the Salmonella, and here there are multiple colonies and which can be recognized easily by their color, and here one can see the specific color of the Proteus. Here these are for the Salmonella, here these are E. coli, and here these are Shigella. So that is very easy to recognize because of their color. So that is the chromogenic culture media. And here one of the masterpiece of the person who have made this picture, and one still concentrate on the eyes and the lips and the nose of the person, and it is really a masterpiece of a person. Now, the diagnosis continuing, third modality is serology. It is the detection of the antigen or the antibody, detecting an immune response to the pathogen from the blood sample. These are qualitative or semi-quantitative or quantitative tests. These include Vidal test, Typhoid test, and Tubex test, which are practically being used. Number one, Vidal test. There is demonstration of the antibodies against Salmonella antigen O, which is the somatic antigen, and H, which is flagellar antigen. And indirect confirmation of the Salmonella infection. It quantifies the specimen with fourfold rise in the antibody titer. It gives false positive and false negative result also. So here one can see the test, which is positive at 120, positive at 140, positive at 180, and positive at 160. So there is fourfold increase in the antibody titer that is going to give the positive test, and here it is negative at 1 over 320 and 1 over 640. So this dilution until it is positive here and negative here, so this is considered to be the positive if that value is fourfold increase, 120 to 160. Now, there are certain false positive results that is seen in case of previous immunization with typhoid vaccine, repeated subclinical or past clinical infection in endemic areas, many bacteria, especially Enterobacteriaceae, having O and H antigen that give the false positive result, healthy carrier of the Salmonella typhi, patients of the miliary tuberculosis and endocarditis, chronic liver disease like hepatitis C, these sometimes give the false positive results in case of Vidal test. Now there are certain false negative results in case of Vidal test, that is, the patient is on antibiotic, 5 to 10% patients do not respond by antibody formation, and in case of the immunosuppressed patient, there is false negative result. So here is the Vidal test, as I have already shown you, that is the anti-O and anti-H. These anti-A is for paratyphi and this is for paratyphi B. And here in case of the Vidal test, here one can see the positive at 120, positive at 140, positive at 180 and positive at 160. And then, so there is fourfold increase that gives that the Vidal test is positive, as we have seen in the previous slides. If there is positive at 160 means fourfold increase. Now continuing the serology, other serological tests are called rapid diagnostic test, and these include Typhoid or the Tubex test. First, the Typhoid test, it is based on the presence of specific IgM and IgG antibodies to a specific 50 kD OMP, which is for outer membrane protein of the Salmonella typhi, which is an antigen of the Salmonella typhi. Now, antibodies which are formed against this antigen, these are IgM, which shows recent infection, and IgG signifies remote infection. The test becomes positive within 2 to 3 days of infection when antibodies have been formed against OMP, outer membrane protein antigen of the Salmonella typhi. It is an indirect solid phase immunochromatographic result. And here one can see 33 kDa Salmonella typhi OMP antigen lot 1.23 milligram per ml, and here is the structure of that antigen, which is the OMP antigen. Now, typhoid test, its biggest limitation is that it is not quantitative, just positive or negative, mean only qualitative. Test lack sensitivity and specificity, 67% sensitive and 54% specific. There is cross-reactivity between antigens of the other disease that give positive typhoid test. So the negative test means absence of the detectable anti-S typhoid antibodies in the specimen or below detection limit of assay. Antibodies are not yet formed when sample was taken. So here one can see the typhoid test, one drop of the specimen and two drops of the buffer are put in the well, and here the test line, and one can see the different interpretation, the typhoid IgM and IgG antibodies lining are there, and here this is the well. So if these two lines comes, C is control and T2 is positive, it indicates IgM antibody. And here if C is present and T1 and T2 is present, it means the both IgM and IgG are positive. And here one can see if C is positive and only T1 is positive, it means IgG is positive. And if only the C is positive and neither T or T2 is positive, it means the test is negative. Some invalid tests are there, that if C is not positive and T1 and T2 is positive, that is called invalid. Similarly, C is not positive, only T1 is positive. C is not positive, only T2 is positive, and all these are absent. These all go into the invalid test. Now, false positive tests in case of the typhoid are malaria 18.5%, dengue fever 13%, gastroenteritis 11.1%, UTI 9.3%, liver abscess 9.3 abscess, tonsillitis 5.6%, respiratory tract infection 5.3 absent, pulmonary tuberculosis 3.7%, rheumatoid arthritis 3.7%, sinusitis 3.7%, and TB of the brain 1.9%. It is typhoid is also positive in systemic lupus erythematosus and viral arthritis. Now, the next text is Tubex test. It contains, Tubex test contains two types of the particles. Please keep in mind, brown magnetic particles coated with antigen, and blue indicator particles, the other second type, blue integer particles coated with 0.9 antibody. So, brown particles contain antigen and blue particle contain antibodies. When antibodies are present in serum, it means the brown magnetic particle which contain antigen will join with these antibodies which are present in the serum. So these antibodies in the serum will attach to the brown magnetic particles which are having the antigen, and they will settle at the base of the tube. Blue indicator particles which contains antibodies remain in that solution, and they are not going to join any antigen, and these will give the blue color. So it means the test is positive. Now, when the serum have no antibodies against salmonella, the blue particles which are having the antibodies, they will attach to the brown particles which are already having the antigen, and these will settle to the bottom, and these will produce a colorless solution. It means the test is negative. The brown particle contain antigen. If antibodies are present in serum, they will combine with that. And if there is no antibody, these will combine with one another, and that is going to give the negative. So here one can see the brown particles which are having the antigens attached to them, and the blue particles which are having the antibodies. If the patient antibody is there, the brown particle which is having the antigen, which will just combine and it will attach to the antibody of the patient. And what will be the result? This is going to settle at the bottom with the antibodies, and the other is the particles which are going to just attach. This antibody of the blue particle is going to attach to the brown particle antigen, and these will just settle down. And if there will be antibodies of the patient, these will be attached by the antigen attached to this brown particle. Other laboratory tests which do help the diagnosis are low TLC if less than 5,000, with eosinopenia, less eosinophil, and relative lymphocytosis. Then blood slide for the malaria to rule out the malaria. Stool examination is important. There is pea soup appearance of the stool. There is no blood. Stool microscopy for any parasite is done. Urine examination, 50% patient had albuminuria and 80 to 90% patient had a positive diazo test, a rapid diazo test done on the urine. But the gold standard for the diagnosis of the typhoid fever is positive culture and positive PCR test. Now the PCR test can detect typhoid within 2 days of the infection. It is very sensitive and very specific test, but it is very expensive, not within the reach of every person. DNA probes for the detecting Salmonella typhi in the blood. Then the last is therapeutic trial. After excluding malaria, dysentery, or pneumonia, therapeutic trial with chloramphenicol medicine is given while awaiting the result of the Vidal test and the blood and the stool culture. And if the patient has responded well to the chloramphenicol, it is positive that patient was having typhoid. Here is again one of the masterpiece of a person who have made this picture. It's really fantastic, and it is just unbelievably that one can think like that. Now, coming to the treatment of the typhoid, first is oral rehydration therapy, that is good nutritious diet, high calorie, high protein diet is advised. General and nursing treatment, even with the specific antibiotic treatment, that has definitely a good role. Antibiotic, where resistance is uncommon, give fluoroquine like ciprofloxacin, or a third generation cephalosporin injectable like ceftriaxone or cefotaxime, and cefixime is a suitable third generation oral alternative. Resistance to these antibiotics has been developing as MDR, multi-drug resistance, or XDR, extensively drug resistance. So the treatment is chloramphenicol, still most effective drug in treatment of the typhoid fever. one can go for the astronom 4 gram BID for 10 days or azithromycin 1 gram per day for 7 to 10 days. Combination drugs are being used sometime for extraordinary drug resistance. These are ofloxacin 20 milligram per kg plus azithromycin 1 gram per day for 7 to 14 days. Cefixime is a suitable oral alternative. Amoxicillin 1 gram 3 times a day plus cotrimoxazole 800 plus 160 milligram BID for 7 to 14 days. And another option is injection meropenem 1 gram 3 times a day plus azithromycin 1 gram for 10 days. Surgery is done if intestinal perforation occurs. Now, what is the prevention of the typhoid fever? That is, provide clean drinking water, good sanitation, and hand washing until an infection is cleared. Infected people should not prepare the food as they are the carrier. A typhoid vaccine can prevent 40% to 90% of cases, effective for 2 years to 7 years. 2 typhoid vaccines are available: a live oral TY2 1A vaccine, which is Vivotif, and an injectable typhoid polysaccharide vaccine, Typhoid VI and Typhoid. Both are efficacious, recommended for travelers to the area where the typhoid is endemic, so they are going to be protected against the typhoid there. So here is the Vivotif oral 3 capsule dose, and here is Typhoid vaccine injectable, and here is Typhoid VI injectable dose for typhoid. Now, boosters are recommended every 5 years for oral vaccine and every 2 years for injectable form. Flies are the vectors of the Salmonella typhi species and responsible for spreading the infection, sitting on the food and contaminating the food. Chlorination of the drinking water has led to the dramatic decrease in the transmission of the typhoid fever. A version of the vaccine combined with the hepatitis A vaccine is available. Results of the phase 3 trial of the typhoid conjugate vaccine is still under trial. This is the TCV, and it is reported to be 81% fewer cases among children by this vaccine. And that is the end of the lecture, and hope so you may have liked this lecture. And you have liked this lecture, please subscribe the channel and just share it with the others. And if any question, please ask on my given number. And thank you very much to be with me and listening and watching me. Thank you.